This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week we're talking about concussions, sports concussions among student athletes in particular. My guests are Dr. Chris Bowers. He's a doctor of physical therapy and an impact-trained physical therapist specializing in concussions. Dr. Chris Bowers, welcome back.
Thank you for having me.
And also joining us is Anna Shuffler. She's a personal trainer and a mother of a student athlete. Hi, Anna. Welcome.
Hello. Good morning.
Thank you. So there's been so much. Chris, we talked a few months back about concussions and student athletes. You have a program that you're working on over there at the physical therapy department.
Yeah, that's correct. What we're doing here is we're trying to capture data on young athletes as they're healthy. So we do baseline assessments for the high risk concussion sports, and then we've put together a protocol to help rehabilitate them. Let's say after the fact, when they do end up with a head injury or a concussion.
Talking to you really impressed upon me the importance of this topic, and it's just, I'm kind of sad about it. I love sports. I think about the sports that we all watched growing up, football in particular, hockey, boxing. So much head trauma goes on in so many of those sports, and we know a lot more now than we did back then, and this is just an issue that's not going away.
Yeah, that's correct. And I don't think we really need to live in fear of the sports. I just think we just need to be more educated on how to perform those sports safely and just be aware of certain symptoms that can occur with mild traumatic head injuries like concussion. And
in putting together your concussion assessment protocol that you do, you actually have days where you bring in entire sports teams.
That's exactly right. It gives us a starting point so that let's say a young athlete does end up with a head injury. We can now get them back into the clinic, and we have data that we can compare them to, and it's their data. So we know what they look like as a young, healthy athlete pre-injury, and now we can compare that to their post-injury assessment, and it gives us a good starting point to how we need to focus our plan of care so that we can help them get better, quicker, and back on the field or court safer.
In expressing the importance of this program, you gave me a statistic that really stood out to me. Do you know which one I'm referring to?
I absolutely do, yeah. I think you're referring to the 1 in 6 athletes will end up with a concussion in their sports season. So that's per season, and that's quite a significant number if you think about it. And that's just the ones that are reported. So there's so many more that go unreported that we just kind of blow off their symptoms like it's not a big deal, and that's where we're starting to see the problem.
And this is a good point to bring Anna Shuffler into our conversation. Anna's son is 10 years old. His name is Brady. Hi, Anna. Welcome again.
Yes.
And we did invite Brady. He wasn't able to make it this week, but he's totally cool with the fact that we're talking about him on the radio.
Yeah, he's okay with it.
And I mean, this topic is important to you. You wanted to share this. Why?
Yeah, I felt it was important to pass on my experience and Brady's experience, and help pass on just the information and help educate parents on what it's out there and how we can help our athletes if they have an injury, and that there is help.
Right. And Brady is a baseball player. He's 10 years old now. Was he 9 when his injuries happened, or was he 10 then?
No, he was 10 when.
He was 10. He is in the 6th grade now.
He's in 5th grade.
He is in the 5th grade now.
Correct. Yes, he is a 5th grader.
Okay. And so during his baseball season, and this was April, right?
Yes.
So what happened with Brady?
So he was up to bat, and yes, he had his helmet on, but he was facing a pitch, and it came in and hit him in the ear, right where the cutouts on the helmet, and it dropped him to the ground immediately.
Did it hit the helmet or?
Yes.
Yeah.
Yeah. So impact was on the outside of the helmet.
Hole kind
yes,
of
right in the ear hole. Correct. Yes.
Got it, yeah. So he hit the ground, and what happened then?
Yeah. So he dropped to the ground. The umpire, they all kind of went around him, and asked him if he was okay. And he got up and dusted himself off, and then he went on to first base.
Yeah. And But it was before too long you started to feel like something wasn't quite right with him? I mean, I don't want to put words in your mouth.
Yeah, no, I mean, so they sent him to first, and then he went on to Steele home.
Okay. So he played the rest of the game.
He played the rest of that inning until he got. As soon as he came into the home, I had already went to the concession area and got a bag of ice. And as soon as he came off the field, I was there, and I took off his helmet, and that's when I saw that there was blood, and it actually had split the ear, and his ear was already swollen quite large. So I pulled him out of the dugout and put ice on his ear immediately.
And a wound to the ear is maybe a bit easier because you can see it, right? And you can treat it that way. But when we're talking about people's brains, it's a little bit more difficult.
Correct. I just was treating, like I said, I wanted to get ice on the ear, try to get the swelling down, and that's when he started saying that his head was hurting. He was hearing ringing, and that's when they made the decision to take him home.
Yeah. And was it just for the rest of the night that his head was hurting, or did this linger for a few days?
I took him home, and not knowing I should have took him to the ER is what I should have done, but not knowing, and really honestly wasn't even thinking concussion at that time. But then I got him home, and then had him looked, and he just kind of laid down and rested for the afternoon for a little bit. He said he was okay, and he decided to go and swim and just kind of carry on as a 10-year-old would. Yeah. Just kind of shaking it off. And then that evening, he was major headache and icing more. So
you said that if you had known, you would have liked to have taken him to the ER that night. Let me ask you, Dr. Chris Bowers. I know I took some blows to the head over the years as a kid. To the ER, is that something you want to see for a possible concussion?
That kind of depends. It really depends on the nature of the injury. I think in Brady's case, it would have been helpful because let's say there was a fracture of the skull from the impact of that ball, or it's always helpful to kind of rule things out and know that it gives you a better peace of mind knowing the information that you're getting from the ER. However, with concussion, you don't always see the initial problems right away. They can start to come in days later when the dizziness, the nausea, the vomiting, the headaches, the inability to concentrate, sleep disturbances, all those things that can start to now manifest themselves 24, 48 hours later.
And Anna, when your son was getting back to regular life, in the days after that, it went from bad to worse, yeah? Yeah.
And I think if I would have, maybe I would have taken him to ER, and I would have been maybe recommended or suggested, did you think about a concussion, and these are things that may happen, in the weeks, or, to look at this, or, watch him for this. It would have been helpful. So then he had practice on Monday. He tried to go to it. Was going to go to it. The coach wanted to know if he was going to be there, and he planned and he wanted to be there. And then later in that afternoon, just right before practice, he got a headache. That was just pounding headache, and so he couldn't go to practice, and so we called him off on practice on Monday. Then Tuesday, he did try to go to practice again, and again struggled with a headache and just not feeling well. Pulled him from practice on that night. And in classroom the next day, got a headache. I took him some medicine. But he had a game coming up on Friday night, so he really wanted to participate. And so he went up, and then he suited up and went to that game on that Friday night.
And something improbable happened.
Yes, it was his second time up to bat, and he took another fast pitch to the ear in the same spot.
It's incredible.
Yeah. Immediately, he dropped again.
Yeah. And this time, did you see the same sort of effect on him, or could you see the cumulative effect?
Yeah, no, I saw it instant, and at this point, we both grabbed Brady off the field and immediately took him home and started icing and realized that he was definitely suffering.
And how so? What was going on with him?
Just not being himself, and he was scared.
Did he seem confused?
He did. Yeah. He did. And I think it just scared was what he was showing and acting like, but I think it was.
Now, given that he was 10, he wouldn't have been Dr. Chris Bowers. You're seeing, when you're doing the baseline assessments, you're seeing junior varsity and varsity athletes? Or
Yeah, we're targeting, right now we're targeting the high school age athletes.
Right, so you wouldn't have seen a 10-year-old.
No, we wouldn't have.
Did you end up working with him later on?
I did. Yeah. I did. And I think that came about because Anna heard about our concussion program kind of through the medical grapevine, and she wanted to pursue care for her child, so she got her in the doors with us, and we started treating him right away.
And what were you seeing with him when he first came in?
The things that Anna's talking about, the dizziness, the confusion, the headache, the inability to concentrate, all of those typical signs for concussion.
Yeah.
So.
And so when you begin working with that, what are the first steps? What do you do?
So you have to start figuring out basically which trajectory you need to go down as a therapist. There's multiple pathways that concussion can affect somebody. It could be an inner ear problem. It could be a neck problem, because a lot of head injuries, there's either impact from an object to the head or the head to an object. So you can have a whiplash type of injury. So you have to rule out any sort of neck issues. Anxiety is a major role in dealing with, or at least the prognosis for adequate rehabilitation for a concussion. You also look at ocular problems too. So the ability for the eye and the brain to connect to stabilize images in your visual field can certainly get affected too. And with I'm a vestibular therapist, which means I deal with the inner ear and how that coordinates its activities through the central nervous system. And so we have some very specific treatments and techniques that we use to kind of help realign how the eyes and the ears and the brain communicate together.
It's time for a quick break on Focus on Your Health. We'll be back in a moment. Stick around. And welcome back to Focus on Your Health. I'm TG LaFredo, and this week we're talking about concussions in student athletes. My guests are Dr. Chris Bowers, he's a doctor of physical therapy and an impact-trained physical therapist, and Anna Shuffler. She's a personal trainer, and she's telling the story of her son, Brady, who is 10 years old and suffered a sports concussion in the spring. What is the brain going through when it's trying to recover from a blow?
So really what happens, when you have this impact to the brain, you get essentially shearing activity to the neurons in the brain. So that shearing activity basically disrupts the cellular membranes, and the contents of those cells leak out into the surrounding tissues. So you initially end up with a physical impact that turns into a chemical problem that results in an energy issue, because now the brain needs to recruit as much energy as possible to that area to start healing that surrounding tissue that's been affected by that cellular damage. And then that's basically the physiology of what a concussion looks like.
And how can we help someone who's a victim of that? How can we help that person to recover?
So you want to bias the energy demands that the brain is requiring. So in order to do that, you have to limit what the energy demands from the rest of the body are needing. So for example, that's why we see a lot of problems today when student athletes get injured in a game or practice situation and they get encouraged to go back into the game.
Is that encouraged in quotation marks?
Correctly.
Sometimes, right?
Right. So they end up going back to play too soon. So now you're telling the musculoskeletal system, you're saying, hey, I'm going to give you the energy so you can go play this game or this sport or run up and down the field, whatever that activity is. And what ends up happening is the brain suffers, and truly that's where the energy needs to be funneled so that the cellular damage can be fixed.
Anna, you're a personal trainer and you're also a PE teacher, so it's safe to say you know quite a bit about the human body, but I'm also guessing this has been a real an adventure for you.
It's been an
education.
Yeah, it's been a great eye opener and a learning process. I was just listening to Chris when I first met him, and actually filling out the form in the waiting room, asking my son these questions. How are you feeling from a scale to 1 to 10? And to have him tell me, well, I'm at an 8, and I had no clue that he was at an 8.
An 8 in terms of like that much pain.
Right. Well, and the questions that you're asked, can be, do you feel nauseous? Do you feel dizzy? Do you have a headache? When I thought I knew what a concussion was, and everyone would be like, well, were his eyes dilated? Did he throw up? Was he sleeping? Those were like this is what a concussion was in my brain. That's what people were, I was thinking it was. And so he's like, well, no, his eyes aren't, pupils are reacting. They're not going crazy. His eyes are normal. No, he's not throwing up, projectile vomiting right now. So no. And so then my mind was like, oh, well, he doesn't have a concussion. I was like, but I did not know enough what a concussion was. So sitting in the waiting room and him saying, yeah, Mom, I'm at an 8 for dizzy right now. And I just kind of looked at him like, yeah. Okay. And then asking the rest of the questions, and then going in with Chris and having him do this, do that, and I was just kind of taken back. And listening to Brady being able to be an advocate for himself, there was no coaches around, there was no pressure to answer, but honestly, and I think that's hard for young athletes, but for Brady to be in that, he felt safe, and he felt like he was getting help. And he was able to answer these questions and give information to Chris that helped evaluate the level of trauma that he had.
We, as athletes, we all want to get back in the game, and then you compound the fact with, we're talking about young people, and there's certainly a degree of peer pressure where their teammates expect them to get back, and then there's pressure from the coaches who are the adults who expect them to get back. Chris, how have you dealt with all of this as you've been instituting these programs and you're out there in the community trying to educate teams and athletes and parents? I imagine, I don't know, have you found some resistance? Have you found willingness?
You know what? You said it perfectly. It's about education, and that typically is the biggest obstacle that we've come across. We have all the right components in place to gather the data and to rehabilitate the athlete after a concussion. But truly the biggest part of the whole puzzle is the education piece, getting the patients, getting the athletes to understand what a concussion is and what symptoms to look for, and also how that impacts their future if those symptoms go unaddressed. Getting the parents involved, letting them know what to look for in their with their child, so that they can kind of be their advocate. If they're not being honest with their own symptoms, the parents can be there to help kind of coordinate that. Getting the coaches and the administration team at the schools so that they can see, those same symptoms and be able to identify things in the classroom, because part of one of those trajectories with a concussion is cognitive fatigue. So it's not only just about how do we get the athlete onto the field quicker so they can play their sport. It's how do we address their problems in the classroom too. It's a return to learn just as much as it's a return to play. So what it comes down to, it's education. And I have a team together. It's a very small team, just a handful of therapists who are going out into the school systems, and we're talking to the coaches during their preseason meetings, and when the athletes are all in one room, we're letting them know as well, and we're handing out information so that they have something tangible to read and look at. But then it really comes down to those individuals to really start to dive into really what's going on so that they are aware.
Anna, we were saying that Brady was first injured. He took his concussions in April. How long was it until you saw him more or less back to normal?
Yeah, it was probably about middle of July when he started not having headaches or not having some symptoms that were a result of the injury.
When you think about all that you and your son went through together with this injury, how do you feel about his future as an athlete?
I'm an athlete myself, and I'm constantly going through injury, and I take whatever measures to KT tape, fix something, work on ice on something, rest something. And I know that there are risks in any sports. There's risks in life. You get injured and you just have to treat it and know how and get the help if it's something that's a little bit more involved. So I'm okay with him playing sports, and I want him to be active, and I want him to have fun. I mean, I want him to go out on the playground. I want him to go play. I want him to be able to go to the park and play. I don't want him to be in fear of this. And I kind of felt that maybe I did put a lot of pressure on learning about concussions, and I did make a big deal about it. It is a big deal, but it's not something that should control your life and limit you from having some fun. You just have to just be aware of it and know how to get treatment and help.
And so we arrive at that same point, that mission of sharing the information with coaches and players and the athletes themselves, yeah?
That's correct.
Yes.
Yeah. The more informed you are, I feel the safer and more confident you can be involved in any activity.
Right. And then as a parent, I would like to see pamphlets, maybe something that's handed out in the beginning of the season and just said, okay, this is how we're going to respond if your child has a head injury, and this is the protocol. I would like to see some type of protocol, and so that we're all on the same page, so it's not like, well, this is your idea or this is my idea or this, but no, we're going to come to an agreement, maybe even a signed agreement that says, okay, this is what's going to happen, and this is what we're going to do, and we're going to work as a team, and just feel a little bit more comfortable with having that information.
Well, my feeling is that parents, as the number one boosters, have the power to influence those decisions.
Right. And I definitely want to take a little bit more of an active role in helping and sharing the information.
Well, being on the radio was a nice step.
Thank you.
Thank you so much for sharing your story with us, and our thanks to Brady. Even though he couldn't be here, thank him on our behalf.
I will, and thank you guys for giving me the opportunity to share my experience. And I can't say enough about the help I received and the guidance and the continued support I received from KRMC and Chris Bowers. That's Anna Shuffler. She is a personal trainer and PE teacher, and she was talking about her son Brady, who is 10 years old and in the 5th grade, not the 6th grade. And that's Dr. Chris Bowers. He is a doctor of physical therapy and an impact-trained physical therapist specializing in concussions. Dr. Chris Bowers, thank you so much.
Thank you for having me.
And Anna, thank you again.
Thank you.
And that's the show. That is Focus on Your Health. I'm TG LaFredo. Thanks so much for listening. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. We'll catch you next time.